Good afternoon and welcome to Channel 7 News. I'm your host, Dexter Hobbs, and we have an important issue to talk about today that is known as disparities. Disparities are defined as inequalities that often occur in diverse racial and ethnic groups who do not receive the same benefits as other groups. Disparities are highly prevalent in the healthcare field. These health disparities include minorities having less access to healthcare than Caucasians and infant mortality rates being higher in minorities than Caucasians. Now, the Affordable Care Act does make an attempt to narrow the health disparity gap to reach health equity by offering many services and treatments. One of the benefits includes the ACA allowing young people to stay on their parents' health insurance until 26. This is very important because disparities among trauma outcomes based on race and insurance are highly prevalent among young adults who are more likely to have high uninsured rates. Allowing young adults to stay on their parents' insurance until 26 is very important because it provides them with access to health insurance. Another way the ACA attempts to narrow the health disparity gap is by offering preventive services and treatments. These services include colon cancer screenings, mammograms, vaccinations, diabetes screenings, and blood pressure screenings that are offered at no cost. The ACA eliminating pre-existing conditions also narrows the health disparity gap by allowing people with pre-existing conditions to no longer be denied health care insurance based on their pre-existing conditions. So here to talk more about disparities in the 9 positions of the American College of Physicians are Ms. Alexandria Montgomery and Mr. Derek.
Well, I'm going to talk to you about position 1 through 5, and then my colleague will finish the rest for me. Position 1 is providing all legal residents with affordable health insurance is an essential part of eliminating racial, ethnic disparities in healthcare. I think position 1 is important because it's attempting to get rid of the racial and ethnic disparities in healthcare by providing insurance to everyone, no matter what their race or social economic status is. Position 2 is that all parties, regardless of race, ethnic origin, gender, nationality, primary language, socioeconomic status, sexual orientation, cultural background, age, disability, or religion, deserve high-quality health care. No one should go without just because of a barrier or how you feel. Language, religion, backgrounds might have things that are a little difficult for us to deal with, but as us being the greatest nation in the world, we should be able to tackle those problems and become a better healthcare system. Position 3 is, as our society increasingly becomes racially and ethnically diverse, physicians and other healthcare professionals need to acknowledge the cultural, informational, and linguistic health literacy among racial and ethnic minorities must be strengthened in a culturally and linguistically sensitive manner. Position 3 speaks for itself. We have to pay attention to our surroundings and educate ourselves on the needs of our patients. Ignorance doesn't help anyone. Physicians and other healthcare professionals must be sensitive to cultural diversity among patients and recognize that preconceived perceptions of minority patients may play a role in their treatment and contribute to disparities in healthcare among racial and ethnic minorities. Such initiatives as cultural competency training should be incorporated into medical school curriculative to improve cultural awareness and sensitivity. I feel a little iffy about this position because you can't teach humility. You can address the issue and you can talk about how it needs to be changed, but you can't teach it. And position 5 is the healthcare delivery system must be reformed to ensure that patient-centered medical care is easily accessible to racial and ethnic minorities, and physicians are enabled with the resources to deliver quality care. You have to be sensitive to things that you don't know about. And so I feel like, yes, the resources need to be there so you can learn about those things, but you also need to have one-on-one interactions with your patients.
The 6th position strives to create a diverse healthcare workforce. They want to attain and also maintain an understanding among health providers and patients. Quality care and equity in the healthcare system are areas they want to also promote. This is a great idea, especially in areas similar to South Florida where Hispanics are growing tremendously. Communication and understanding is very important between providers and patients. Position 7 stresses that social determinants such as income, availability of nutrients, foods, environmental health, and early childhood education are issues of health disparities in a minority population. These issues must be addressed to fix issues in health disparities. Regarding the 8th and 9th position of American College of Physicians, the 8th position stresses the overall health status of an individual can be significantly affected or impacted by their environment. I agree, individuals living in poverty communities are more subjected to violence than others than those who are. Position 9 stresses that more research and data are needed related to health disparities about racial and ethnic groups to help empower stakeholders to address problems of health disparities. The more evidence and reliable data we have will show stakeholders this issue is worth investigating.
Moving on to our last segment, we will be talking about disparities and how they relate to HIV and AIDS in the healthcare system, and how disparities relate to access, quality, and cost. Here with me are Dr. Shanks and Dr. Harris. So Dr. Shanks, we'll begin with you. How does disparities relate to access, quality, and cost?
First off, I would like to say that health disparities refers to the differences in health status of different groups of people. Acquiring access in the healthcare field is important because in order for patients to receive services, they must be able to access the healthcare system. But it is very difficult for those groups of people who do not have the opportunity to receive benefits, such as a lot of minorities. The cost of healthcare can refer to the federal, state spending, production, and resources needed for patients, the price of insurance, and out-of-pocket costs. Consequently, clear disparities exist in the rates of healthcare coverage among the poor, the young, and ethnic minorities. Quality. Quality healthcare means doing the right thing at the right time in the right way for the right person and having the best possible results. Those groups of people with low socioeconomic backgrounds, the disparities that exist can lower the level of healthcare quality in certain facilities. As the cost of healthcare insurance increase, consequences of being uninsured can include fewer preventative services, poor healthcare outcomes, higher mortality rates and disability rates, and advanced stages of illnesses.
So Dr. Harris, how does HIV relate to disparities?
Well, as we all may know, HIV and AIDS have been controlling the disease world for years. HIV is not curable and it can never go away. Therefore, any persons with this disease is confined to HIV and AIDS for the rest of their life. As learned from one of our previous speakers, some people with this disease can catch it in the early stages by getting regularly HIV and AIDS tests, and it will deplete the virus as much as possible, but never completely. Therefore, frequently getting tested and treated can increase the time of living and decrease the death rate. The majority of the HIV and AIDS population are most likely to be racial, ethnic, minority, and poor, as Dr. Shanks, to the right of me, said, and that goes hand in hand with cultural competence. The amount of people that need care for their HIV virus is significantly increasing by day, which happens to be taking a toll on healthcare. There are an estimated 800,000 to 900,000 people living with HIV in the United States, and 300,000 are living with AIDS.
Go.
Disparities are highly prevalent in today's society. Though many efforts have been made to reach health equity, disparities continue to persist throughout our healthcare system. A major problem in terms of disparities is the exponential growth of the minority population in the U.S. in the following years to come. Since minorities are disparities' primary target, the future of the healthcare system must change to adapt to the influx of minorities in order to provide health care to all and to also narrow the health disparity gap. I would like to thank all my guests for coming today and giving us their knowledge. I'm your host, Dexter Hobbs, reminding you to be blessed, be caring, and to be aware. See you next time.